Hi, my name is Taylor Chatwin. Today we are doing the abdominal exam. Today's date is October 21st, 2025. This is my patient. My patient is going to be lying down for this exam. Knees are actually going to be bent like this, obviously because it's a mannequin. The knees are not going to be bent, but they are going to be bent typically, and patient is going to be gowned. So I'm going to start the exam by asking my patient, is it okay if I examine your abdomen today? Yes. May you please split your gown for me so that I can inspect. So this exam starts with inspection. We're going to be inspecting the surface, the contour, and for movement. So surface inspection could be something like if there is rashes, bumps, striae. We're looking at the umbilicus. That's what we're kind of visually inspecting for. For the contour, is there protuberance or is it flat? So some of the F's of protuberance could be fat, fluid, flatulence, fetus, fecal, fatal tumor, or fibroid tumor, or is the abdomen area flat? And finally, we're looking for movement. This could be peristalsis, or it could be, it could be indicative of if there's slow pulsations or pulsations at all, that could be a bad thing. So once we do the inspection, we're actually going to jump to auscultation. So I'm going to use the diaphragm side of my stethoscope, and we are listening for abdominal sounds. There should be around 4 to 35 abdominal sounds per minute. So we are going to be checking for that using the diaphragm side. Around 3 to 5 seconds in each area. So nothing there. Next thing that we're going to listen for is we are going to listen for the diaphragm for the splenic or hepatic rub. So we're going to go along those costal margins. This could be indicative of a tumor, liver cancer, things like that, and basically inflammation. So could be a big indicator of inflammation if we were to hear any rubs or anything at that point. Finally, for this part of the auscultation, we're actually going to listen for bruits. So we're going to use the bell side of the stethoscope, and we are going to listen to different arteries. So we're going to start with the abdominal aorta. Then we're going to go to the right and left renal arteries. Right and left iliac arteries. Right and left femoral arteries. About 4 to 20% of people have abdominal bruits. Once we finish the bruits, we are going to go into percussion. So I am going to percuss. We're listening for tympany. We're listening for dullness. So let's listen for it. We're going to go 4 quadrants clockwise. Perfect. Then we are going to listen to, we're going to find the borders of the liver. So we're going to find superior and inferior border. We're going to do this by starting at the midclavicular line superiorly. We're going to work our way down, listening for when we find dullness. And then we're going to do the same thing, but we're going to go up. Please shield. Remind your patient to shield. Now we're going to go back up. Again, that is a way for us to figure out, where the borders of the liver are. Next thing that we're going to do is we are going to percuss for the spleen, or if there is an enlarged spleen. So we're going to listen for dullness along the left costal margin. Perfect. And then we are going to actually do a Murphy's test. So this is for the kidneys. So your patient is going to sit up for this portion. You're going to find the costovertebral angle. You're going to put your left hand on that, and I'm going to use my right hand to percuss. So I'm going to hit. Did that hurt at all? Did that hurt at all? You're going to do that bilaterally. So you're going to make sure that there's no pain bilaterally for your patient doing that percussion test. Finally, we are going to go into palpation for our patient. So we start palpation with a superficial palpation. So we're going about 1 inch deep. We only need one hand for this. 4 quadrants. Next, we're going to go deep for the next one using 2 hands. 4 quadrants. Perfect. Next, we're going to be palpating for the liver. We're going to be using the hook method. So we're going to find the margin of the costovertebral, or the costal margin, excuse me. And we are going to push in, and we're going to actually hook our fingers. We're trying to find that inferior border. Okay. Next, we are trying to find the gallbladder. It's testing the gallbladder. So we're actually going to do very similar. We are going to be pushing in under that costal margin, pushing inward and up. And is any of that painful at all? That could be indicative of any type of inflammation or things that are going on within the organs. Organomegaly, a lot of this we're feeling for inflamed organs. Next, we're going to be testing the appendix. So we're going to start with McBurney's point. You're going to find the ASIS, and you're going to find the umbilicus. You're going to go about 2 inches from the ASIS towards the umbilicus. So here's the ASIS, here's the umbilicus. We're going to go about 2 inches. We're going to push in there. If there's pain, that's a positive sign and could indicate inflammation or appendicitis. When we release, we're testing for rebound tenderness. So if it's painful upon release, that would be what is known as rebound tenderness. Next, we are going to be testing for Rosving sign. So we're going to push on the left lower quadrant. And if there's pain in the right lower quadrant, when we press on the left, that would indicate a positive Rosving sign. So we're going to do that now. Okay. And then we're going to do the psoas sign. So we're going to push down on the quadricep of our patient, and we're going to ask them to try to flex upward. Next, we are going to be palpating for the kidneys. So we're going to be using a P to A with our left hand on the side that I am on as the doctor. We're going to go P to A, and then we're going to use our right hand, and we're going to be pushing A to P, and we're trying to find that kidney in between our hands, palpating. Now we're going to do the same thing on the other side, but I'm going to use my right hand P to A, and I'm going to do my left hand A to P, right under those costal margins. Then we are going to be testing for the spleen. We're, again, looking for organomegaly, so enlarged organs. So we are going to do a very similar test where we go P to A with one hand, our supporting hand, and we're going to go A to P with that other hand. And we're pushing down to try to feel for an enlarged spleen. Next, we are going to be feeling for the abdominal aorta. It should be no bigger than 2.5 centimeters. And so we are going to be going down, finding the borders. And that concludes our abdominal exam today.